Yeah, hold on, sorry. My foot literally just fell asleep. BRB. That's what happens when you get old. My name is Dr. Luke Ayura from Chicago originally. Did undergrad at Northwestern, where I studied history and music. Very right brain, and took a little detour to Japan. So when I was an English teacher in Japan, after undergrad, I taught kindergarten through high school in a small town in rural Japan. And during that time period, my second year, I ended up getting sick. And the town I was in was so small, they had one clinic. And when I went to that clinic, the communication, my Japanese was not great at that time, still isn't great. But it was really difficult to communicate and actually even have the doctor understand what was going on with me. And so, I looked everywhere, and my friend he taught an English conversation course, hour and a half away, another small town. And one of his students was a radiologist, and she wasn't even internal medicine. She's like, come on down. I'll take a look at you and figure out what's going on with this foreigner. See if we can help him. And so I drove. It was the end of the day, and she and her husband worked they run their own clinic. And it's actually a hospice care center. And she took me in after the day was over, and she still takes care of her patients, and she brings me into the office, and we bust out the dictionaries, and she takes every effort to really kind of understand and figure out what was going on with me. I remember feeling so helpless and vulnerable, and the fact that this woman, Dr. Hayashida, took her time and took the care to listen and understand and be compassionate was something that really stuck with me. And after that experience, even though I was never thought about dentistry specifically as a profession, I thought about how healthcare has that access point to really connect with other humans in a way, that are in pain, that are suffering, and be the great equalizer. And so that's what got me into the field. And it set me on a path where I came back and did my pre-dental at Loyola in Chicago, and then I went to Michigan for dental school, and did my residency in South Texas and San Antonio at the VA hospital, which was an awesome experience. Learned a lot, and came back to Chicago and worked in private practice, 5 or 6 different associateships, one of them being with this great guy here, R.J. Villa, Dr. R.J. Villa, and we worked together for 3 years every day, side by side, and learned how each other worked, got to know each other, and really had a passion for dentistry and doing things the right way, and also having fun while doing it. And so we went on a journey together a couple years back to start this.
Yeah, my name is Dr. R.J. Villa. I grew up in the northwest suburbs of Chicago, a place called Long Grove, Illinois. I did my undergrad at University of Michigan, studied brain behavior and cognitive science, very fancy way of saying neuroscience and psychology is blended together. After that, I took a year off between college and dental school to do some day trading, kind of test my water in that. Saw some of my friends were doing it, felt like I could do that also. But dentistry has always been the passion. So my grandpa, he came here from Cuba back in the 50s, teaching American doctors new procedures in gastroenterology. Back in the day, Cuba was a little bit more advanced medically then. And so he was able to come here. He invented the colonoscopy camera, saved millions of people's lives. And my dad followed in his footsteps. My brother followed in the footsteps. But medicine never really appealed to me. I didn't want to deal with chronically ill patients. I didn't want to be in a hospital. The setting just isn't for me. Dealing with these, massive emotional issues as well. And when I found out that, dentistry existed, it's in healthcare. You're literally face to face with people. You're not typing on a computer. I have to worry about too much bureaucracy as compared to medicine. And I work with my hands. So to me, dentistry is like adult Legos. Mm-hmm. You're putting pieces together, getting everything organized, and trying to be as refined as possible while you're doing it. And then, once I found the passion of dentistry, I knew in high school I wanted to do that. Graduated from college, took a year off, but applied to dental school, and I went to Marquette for my dental training. Did a 1-year residency at a place called Appleton, Wisconsin, which is near Green Bay, which is Boot Packers. And then came down to Chicago because that's where I wanted to know that's where I wanted to practice. I always wanted to establish myself in Chicago. Started working at this associateship with Dr. Ayura here. Like he said, we kind of saw each other's philosophy, loved each other's work, understood where we could kind of fill each other's voids, and we became such good friends that he actually stood up in my wedding. So kind of full circle here. And we kind of saw each other and we saw our skill set. We realized, hey, we could be doing this better than anyone else in Chicago. Let's join forces. Let's create not only a beautiful environment for our patients, but a beautiful environment for ourselves and our staff. And now we're here. But when I first moved to the city, I lived a couple blocks away from here, and I fell in love with this area. It's safe. It's got, high quality people around it, people who are very ambitious. There's a lot of access to not only like Michigan Avenue, but the rest of the city, very close to the heart. And when we were looking around, we literally looked at, 30 different offices and really getting really picky with what we wanted to do. Mm-hmm. Initially, we wanted to do something on retail space. And we realized that our bank wasn't going to give us a loan that was going to compensate the amount of rent that was required if we were going to be on that retail space. And so even though we were looking around, our realtor was like, hey, check out this space on the second floor. And once we came in here, we saw the windows, we saw the space, we kind of had a vision for it. We knew that this was the location.
Yeah, it was actually the second time around. We first discounted this space because it's on the second floor.
Yeah, you didn't even want to see it.
We didn't want to see it.
Yeah,
we're like, okay, next.
Yeah.
And then we came back to it and came in, and it was just completely blown away.
Yeah.
It used to be a bridal shop.
Yeah.
And this was the showroom in the front, and they made the dresses in the back, and it was a perfect space. Every operatory has a window.
And looking back, it's great because Chicago is not known to be the safest city. Luckily, this area is the safest area in Chicago. Knock on wood, keep it like that. And being on the second floor, not only do you get the beautiful landscape of the city, but you also get that safety of being, a floor above too.
Yeah. Well, the biggest difference, I think, is that we are not, a large corporate office, and we provide all the amenities that everyone has, right? All the comforts, and we take pride in that. But those are really the icing on the cake, because really the true difference is that we really care. It's our name on the door, and we built this thing from the ground up and put every thought into every detail. And we're still monitoring stuff and correcting things and growing every day, but we care about the smallest aspect, and so that reverberates to every level of the patient experience.
Yeah, I think another thing that makes Boca different than all the other dental offices in Chicago is we are truly a one-stop shop. You can come in for anything that you need, and we can take care of 95% of those cases. We do implants, we do wisdom teeth surgery, we do orthodontics, cosmetics, normal restorative dentistry. And so because we've done our training to incorporate all these different specialties, we kind of get the full bird's eye view of anyone that comes into our office. So we can take care of them from start to finish. Very complicated cases or cases that do involve, more complex procedures, we'll work with some other specialists to make sure we get the best outcome possible. But we wanted to cater to our friends, cater to our family, cater to our patients. Just know that when you come in here, we're going to be taking care of you from start to finish. Everything's going to be as effortless as possible. We strive on the fact of elevated comfort. We want you to feel comfort in an elevated environment, know that you're going to get the quality work that you need for your mouth to stay as healthy as possible for as long as possible, and do whatever we can to make you happy.
Yeah, the comprehensive aspects, me and Dr. V are both general dentists, but we both love doing everything, especially surgery.
Yeah.
But we love every aspect of the piece of the puzzle.
Right. Kind of control freaks also.
Got a little bit. Yeah, but I think the comprehensive care aspect is we see the whole picture for you, and we are thinking about every single specialty as we're treatment planning with you. And so the ability to be able to not only see that context, but also deliver those services within our scope, is really special, because we get to really provide awesome comprehensive care, right, start to finish.
Yeah. Yeah, one of our duties as a dentist isn't to just tell you what to do, it's to give you your options, and you make the best decision for you. Mm-hmm. And so because, like you're saying, because we have that insight from all these different scopes, we can give you that best option, the alternatives that you're most comfortable doing.
Well, there's the technology aspect. We are a very tech-forward office. We have the latest 3D scanners. We have a cone beam machine to take advanced imaging, to make surgical guides, and digital smile design, orthodontics, Invisalign. And so those are kind of the general trends in tech. We also want to do crown billing. Right?
Yeah, same day crown, right? Yeah, the technology behind that has gotten so much better over the past 5 years. Before, research was saying there's about a 25% change in the final outcome versus what a 2 size should be. So 25% difference. That's a big margin of error there. And now we've gotten so refined on that. So the materials have gotten better. The technology has gotten better. We also do some other ancillary things that we incorporate here. For example, one of the biggest things in medicine and in dentistry is PRP and PRF. This is essentially platelet-rich fibrins that uses your own stem cells. We draw your blood. We use your own stem cells to regenerate bone, accelerate healing, make sure things are very predictable. And so that's going to be not only incorporated in, people have heard it for, hair or for their skin, but in the mouth, for injuries. These are things that we can be incorporating. We already do. That kind of puts us above everyone else. The other thing that we provide is IV sedation. Comfort is like the biggest thing. We want everyone to be as comfortable as possible. Anxiety is a huge thing in dentistry. Anxiety is the biggest factor why a lot of people don't make it in to the office. And so by having IV sedation being in our office, it's a great adjunct, right? You want to talk more about that? Or?
Yeah, hold on, sorry.
My foot literally just fell asleep.
PRP. That's what happens when you get old. One of the major things that we provide at the office is anxiety management. Not just about the general experience. Dr. V and I take great, care with every patient to treat anxiety just on a basic level. But to be able to treat it with sedation is something that's really special. And with the training that I received at my residency program, I'm able to provide intravenous moderate sedation, which puts you in a state where you're calm, relaxed, and can really take a lot of the anxiety away and make it almost a pleasurable experience. And it's not just about the medications, it's about the setting that we provide. We create this calming, relaxing environment with sounds and music and just making you feel comfortable. So it's not just medication-based, it's the whole experience that goes into the sedation part. And so, we understand that anxiety is a big reason why people don't come to the dentist. Yeah. And so we want to do our best to, tackle that from every aspect.
Yeah.
Sedation is one of the things we can do.
Yeah. I think with technology, I think the thing that we're probably going to get next, the next toy, we're looking at doing the 3D printer. So now that those materials have gotten better, we can be printing our apparatuses or devices or night guards or crowns so that it's not only efficient, but it's durable as possible too.
Yeah, I think it's interesting. We were talking previously, like in dental school, scanning was just 3D scanning for the crown was just getting started.
Yeah. Right.
So the one I used, just you had to put powder on it. And if it got a little bit wet, it was useless. And it was just a pain. I'm like, I'm never going to use this. And now the technology's gotten so much more advanced. So, and I think in our time frame, in our careers, we're kind of at an inflection point where we are experiencing a great increase in dental tech, which is so cool.
Yeah, I think the first, probably the last couple decades have been really focused on more materials, right? Material selection and making sure something that can mimic the same naturalness of a tooth and its functionality and its durability, for the long term. And that has been great because that's changed dentistry substantially. From going to those silver fillings to now using bonding agents where we can use cosmetic composite fillings, that changed dentistry, in my opinion, for the greater. But now we're going to the digital realm, and now we're just exponentially increasing those outcomes. Yeah, so we first started with the onboarding process. We wanted to make sure that when you're filling out your forms, everything can be done on your phone, as easy as can be. We ask for the information that we need. We'll even reach out to you to gather that information and make sure we verify, especially if you have insurances, any benefits ahead of time. So there's no surprise when you're coming in here. We kind of know the whole stream of your fee schedule. As we get to know you more, you come into the office, it's all about the environment, making sure that you're as comfortable as possible. What's great about Dr. Ayura and I is we're all about expertise with authenticity and that comfort. Our whole goal is to provide that elevated comfort experience. And so whether it involves, noise-canceling headphones or TVs on the ceiling or sunglasses or even, minor things as a valet out front or a custom scent in the office, these are all the little details that we tried to put together to make that experience just supreme.
Yeah, absolutely. And I think it's the next level is just the care to the details of every aspect of the process. Like all those administrative details, that says a lot about like how, the business is perceived. It's not just about me or Dr. Villa or the dentistry. It's about the whole experience. And so every part of that needs to be calibrated and care has to be put into every step. Otherwise, the foundation doesn't work. And so that's the level of, care we bring. We really care about the process, making it, I don't know. I think one of the big issues that people have with dentistry is a lack of transparency, whether it's on, the billing side. I mean, insurance is just forget about insurance.
It's a whole other guy.
Whoa. Yeah. I thought, yeah, anyway. But we make that process as easy as possible. And we take on all those variables, give the patients, as seamless as an experience as we possibly can, even though there are a lot of us.
So one of our passions that we both like to do together is play golf. He'll constantly tell you that he's better, but
I will never say that because
the track record.
you're both off.
We're both out. We're both terrible. Why it works so well? We're better at teeth than at
So how many
white teeth versus white ball.
how many trees versus greens did you do?
Yeah. We call him the lumberjack.
Yeah.
He loves doing the trees.
I do wear a lot of flannel on the horse as well.
Yeah. So, we kind of have that passion. What is nice out of Chicago, we have to take advantage of being outside. One of the other big things that we love doing, and, I love doing it, is live music, going to live festivals, as concerts. Chicago has some great names that they bring in all the time. So love incorporating that. I have a wife now and her dog. We love hanging out with them and, bringing them along for all these adventures in the city. And then, to turn your brain off, you have to do that. We're making decisions, all these micro decisions all day long. And, sometimes be able to turn your brain off and let, just follow a game plan. So I like playing video games. I think, that's also one of the reasons why I feel like I have relatively good hands.
Just put it in growing up.
Yeah, and there's actually some research like it did. Best surgeons, have played video games growing up. And so that's something I still try to incorporate to kind of switch gears a little bit and do something more on the creative side.
Yeah. We're just talking about Turtles in Time.
Yeah, Turtles, classic.
So actually, me and Dr. Villa, we love going to see music a lot together. That's one of our main passions. Love to move, get in rhythm and, kind of forget about, all the pressures and stresses. And one of my favorite things to do in the summertime is get on my bike and just bike the city. Biking Lakeshore Drive. I can actually bike to work now, and it's great. Get a little bit sweaty, but that's okay. But yeah, it really just kind of frees up my mind. And, I just love exploring all new pockets of Chicago. And I found this place by Naden Pier. It's a great spot to watch the sunset. Just it's a park I'd never gone down. But there's always something new to explore. And when you're on your bike, you don't have to worry about, parking or getting tickets because they'll get you I'm mobile. Yeah. Hey, you got a tree? I'm good. I'm good. Backpack, tree, bike. I'm good. So, yeah, it's one.
You forgot to mention your supreme cocktail making abilities.
That is true.
Yeah,
that is true.
You'll not go thirsty if you ever go to a party by Dr.
You will not. We're gonna try something different. Yeah. Yeah. I'll make something with anything, but yeah, we'll have a good time. My main passion, if I was not a dentist, it would definitely be a musician. And that's one of my big passions. I studied music in undergrad, played piano since I was a kid, played saxophone, and then when I discovered guitar at age 16, it was game over. And the noise complaints just kept coming. But, I love music. It allows me to express myself in a way that, honestly, it's a whole different vibrational energy that allows me to just get myself out there. And that's my peace space.
So we'll start the Boca Band.
We'll start the Boca Band.
I'll play the saxophone. You'll do the guitar. I'm sure some of our other staff knows how to do.
Train them up.
Yeah, train them up. Some drums, maybe.
Yeah. Noise complaints. Yeah. Okay, good. Yeah. Yeah. So we've been very focused on building the details, from the ground up with our practice, our first practice here, and we want to make sure we get everything, as foundationally solid as possible and deliver an amazing patient experience. And, then our goal would be to expand to, a couple offices, not a lot, but to maintain the quality, and not become a big, corporate, chain where we don't have control over the details as much as we would.
Yeah. Unfortunately, as you grow, the quality has to decrease. It's hard to maintain those same power players in all these different aspects. So you want to be able to maintain, like you said, that same quality, that same control, that same care. Make sure you feel like your family. You're not just a number. You don't just care about, how much, dentistry you need, but we want to know you on that personal level.
Yeah.
So as long as we maintain that and we can maintain that as we grow, that's the biggest priority for me. We want to make sure that we stay true to ourselves.
100%.
And we're not just, looking for it, from the business side of it.
Right. Yeah. Right. And the nice thing is, our names are on the door. You're going to see one of us when you come in. Our name is on everything we do, and we take great pride in that. And, that goes into every detail. So, that's what's different about it.
So first, you want to make sure that you like the profession, right? Dentistry is very taxing, not only emotionally, but physically also. You're over people, you're contorting your body in certain ways, not like an athlete in a sense, but definitely
Dentally.
Yeah, your back, your neck, your ears, your eyes, it all takes a toll on us. So make sure you're prepared for that and you're taking care of your body. For me, the reason I'm the dentist I am today is, I did a residency after dental school, which was like 3 years of private practice experience in 1 year. And I learned so much from that. I was working one-on-one with all these specialists, these endodontists, these oral surgeons, all these different specialists. And I got to pick and choose my toolbox. And what I learned from that, I came out of dental school, I won this operative dentistry award. I came out thinking I was God's gift to dentistry. And I learned really fast, like, you don't know shit. And so I got humbled really quick. And I think the biggest thing is if you're a newer dentist or coming out, allowing your dental ego death to happen. Understand that you always have to learn. You always have to be striving for better. Just because you've done one thing, you've had success, doesn't mean that's the best way to do it. One of the favorite conversations I like to have with other dentists is, how do you do molar endo? What's your process? How do you do a filling? Because I might pick up something that I like that they do, or they might pick up something that I like, and it's just better for the profession overall.
I think dentists self-select a little bit into like the type of person that becomes a dentist. You have to have good attention to detail. You have to be very kind of critical a lot of times. Mm-hmm. And, the dental field is very like detail oriented, and, millimeters matter, fractions of millimeters matter. The line between, success and, not success sometimes can be a little bit thin. And so that for a person that is naturally motivated and wired that way, it can kind of get you a little. Mm-hmm. And so finding ways to go easy on yourself and relax and, make sure you zoom out and, look at the big picture, get out of those loops, just zoom out and take a breath and just realize that it's an awesome profession. And the details, even though they matter, they're not everything. And so go easy on yourself. Oh, if it's after surgery, discomfort management, pain management, that's what we're all about. And that happens before the procedure, getting rid of anxiety, making a good plan, coming in the day of the procedure, making sure we control as much as we can in terms of your comfort.
Yeah, you should feel nothing after procedures. Anytime you've gone to a dentist and you've been feeling something, please let your dentist know that I'm feeling something. Any good-natured dentist will always listen to you. They'll give you more anesthetic, whatever they need to do to make sure that you're comfortable. So during the procedure, I think the most important to know that, you're not going to feel anything.
Yeah, and like, let's be honest, dentistry is uncomfortable. It's not fun to have your mouth open like that. We have to give the anesthetics. Those are not super comfortable, even for a very well-trained hands like us. And so, we're very realistic about that. But which one is left? But no, we care about your comfort during the procedure, and controlling all those variables as much as we can is important. But afterwards, we place as much, priority on that as well. Mm-hmm. We give really good instructions on how to take care of yourself, for each specific type of procedure. If it's a surgery, we're going to send you home with, an ice pack and some care instructions, instructions for eating, diet, all that stuff, normal stuff. Yeah. But beyond that, like, for example, if we're doing a surgery and we're doing sedation, and give you extra medication through the IV to lower the swelling response and the overall pain response. But really, it's a good technique, good communication. Really, I think is the main thing. We're here. That's the other thing, is we are here to take care of you afterwards. We're not just going to drop you off and say bye. We give you our cell phones or emails, and we always really care about that.
Yeah, we want to be accessible. We want to be there for you. Mm-hmm. We understand that anything that happens in the mouth, especially if you're not trained, can seem like a pretty severe emergency. And dental pain itself, if you've ever had it, is so severe. I've had guys that are 6'5", 300 pounds, crying because they had a tooth issue. Yeah. And so we want to be there to alleviate it. So have that accessibility, being open late, mm-hmm. open until 8 p.m. most days. Like you said, have our direct contacts. You can email us directly and we get back. You're not going through, 4 front desk people, then they give us the message, then I have to respond to you. So 4 days later, you're getting a response. You'll usually get a response within 24 hours, especially if it's something, more severe. So, aftercare, you talk about the surgery side. I could talk about more of like a routine side, after you get a cleaning or fillings, if there's an area that we worked on, you want to be a little more delicate on that side. softer diets. Don't chew too heavy. Don't go too crazy on it. Imagine that you just worked out legs. And
have you ever done that?
I got back into it recently, just for you, Dr. Egger. And just imagine you work out legs, and now you're super sore, and now you see this mountain of stairs to climb up. You'll probably take the elevator, that day, right? It's kind of the same thing with the tooth. You get work done, don't take the stairs, take the elevator, make it easy. The biggest thing as dentists, if you want to save money at a dentist, the biggest thing you can do, flossing. Get in there with that string. The string is king. People like the water pick, which I think is a good adjunct to flossing, but it doesn't replace the flossing. So make sure you're taking care of the teeth, brushing, flossing every day. I do still use fluoridated toothpaste. I know there is a lot of contention of that online, but fluoride is one of the most heavily researched things in dentistry, so it's very safe to use. And but flossing, getting that string in there, that's the thing that's going to save you a lot of issues. Yeah, so one of the great things about Boca is that we are a one-stop shop. We can take care of everything you need in terms of dentistry. From orthodontics, cosmetics, so oral surgery, implants, basic restorative stuff. And so what I'm realizing, now, especially having a family in medicine, and my wife, her mom is going through some medical issues, and pretty severe medical issues. And she has something going on with her heart. She has to see 6 different doctors, each appointment spread out by a month or two. And we're here, the heart isn't my forte, so I can't really give too much advice on that. And we're waiting, and we're just waiting for things to just all of a sudden pop. And so what's great about us is we can take care of all those different specialties, all those different views, all in one appointment. We'll go over your treatment plan with you, look at the different options that you have, but take a look at things from an interdisciplinary level versus just a restorative side or just a surgery side. One of our biggest philosophies is we want to structure empathy with expertise. And one of the things we try to do here is we try to break down these barriers that cause a lot of people to be anxious when they come to the dentist. When we talk to our staff, we ask them, like, hey, what do you like about working with us? And, one of the things they brought up is, we're very real people. We don't come in with our white coats. We don't come in, very strict and very cold.
We have great jokes.
Great jokes to us. Yeah, we're great jokes to us. But, they like to know that we're decreasing these barriers and making sure that we're listening to you. And any question you have for us, whether it's crazy, whether it's very technical, we want to be there to answer those questions for you. So nothing's outside of the wheelhouse for us. We're really easygoing guys.
Cool.
We wanted to be those dentists who are seen as more of a friend who's a dentist versus the dentist themselves.
Yeah, the most important, that's absolutely right. The most important thing I think for patients to understand is that we actually listen. I think a lot of people have had experiences where they felt like maybe their healthcare provider or dentist or whatever just wasn't listening to what they were saying and didn't get a complete picture. They didn't have enough time, to really get into what's going on. And so, we like to take that time with every patient and really make them feel comfortable.
Yeah. And not only us, it starts with our team. We make sure we get a great team that's understanding the same.
We have a team.
And a lot of our members have gone through a lot of dental work, so they have firsthand experience in knowing, hey, this is what needs to be done to make you comfortable during this, and anything we need, we're here for you.
Yeah,